Hi, this is Dr. Farley, and this week's blog I want to go over with you some information about the brain and hormones and neurotransmitters and inflammation. So this is important for really depression, anxiety, bipolar patients, Parkinson's patients, dementia patients, anything really to do with the brain, which is really everyone. So what I want to go over with you is, again, about the idea of the brain and the gut and the microbiome and that connection there. And there's some really interesting information that's been out for a long time frame. And what you want to know is this, that your microbiome is like a separate organ that sits inside of you. And your microbiome, which is made up of bacteria, and there's about 700 trillion of these that sit inside the body. Over a time frame, they do a lot of different things. But one of the things that you should know about is that the microbiome can influence immune function, can influence all your hormones, can influence your metabolic rate, and can also influence all your neurotransmitters. The microbiome, those bacteria, actually produce neurotransmitters. So if we're talking about a person that may have a serotonin issue and that may have symptoms of depression, or we're talking about a patient that may have dopamine issues that's having issues with Parkinson's or movement or addiction, or we're talking about any of the issues with the brain, you want to know that the microbiome is a major role, because those bacteria actually can synthesize these, and then they're sent into the circulation, and they can impact your brain, behavior, moods, attention, movement, everything. What you also want to know, though, is that the brain itself is a key regulator of the microbiome. And hormones released from the brain, especially the stress hormones in epinephrine and dopamine, those hormones will immediately change the bacteria in your gut called your microbiome, and throughout your whole body, immediately. So this is one of the reasons why we look at the brain and not just look at the gut and the microbiome, even if that's an issue with someone. Because the brain can be influenced by the gut and the microbiome and the immune system, and yet the brain can influence the gut and the microbiome and the immune system. And they play on each other back and forth. And then there becomes this negative cycle over and over again. So, and behavior and cognition, meaning the end result of this, could turn into depression, anxiety, bipolar, anger, schizophrenia, I can't sleep, appetite issues, anything under the sun, inability to concentrate, lack of being social, all kinds of problems. And again, most of this is a true problem with how the brain is working. These are not psychologically based. They're not. And if you do an evaluation on this and you don't find anything, well, then you might go into the idea this is psychologically based. If you've also tried numerous medications, or you don't want to try the medications, or you don't believe that that's the cause of this, we may have some answers for you by looking at this from a different perspective. So thank you and have a great day.